Take 5 for Eyes, Episode 2, recorded June 29th, 2013. Tools of the Trade.
Welcome back to our second video at Fluder VisionCare. I know you've been dying to have us show our next video here, so without any further ado, we're going to get started. My name is Dr. Barbara Jean Fluder of Fluder VisionCare, and I'd like to welcome you back. Today's video is going to talk about some of the equipment we use in the exam room. I've been doing this for 20 years now, and people always say to me, you have the neatest toys. And a lot of people will ask, what is this for? What's that for? People are always intrigued by all the high-tech sort of tools and instruments that I use on a daily basis. So I thought we'd go over some of the things just to inform you and educate you about some of the equipment that we use to perform the eye exam when you come into Fluder VisionCare. The first thing we're going to talk about is what we call a phoropter. Now, I went online and did some research, and the best I could find is that the original phoropter was patented by a company called Reichert, who is still in business, by the way, and the first phoropter was patented in the early 1920s. And today, the phoropter that we use, albeit they look newer, they look more high-tech, the design and the mechanism, if you will, of the phoropter and how it works is exactly the same. Nothing has changed from the original phoropter design in the early 1920s. We use the exact same lenses and formulations and calculations that they did when it was originally designed. So I think that's really something kind of neat in today's day and age where technology is always changing. The phoropter hasn't changed since the 1920s. The phoropter, and some pictures are going to be superimposed during this video. So the phoropter is the instrument that we bring right in front of your face. It's kind of rounded. You look like, or you feel like you have bug eyes. And what it is multiple lenses, literally hundreds of combinations of lenses that we can come up with to determine what your eyeglass prescription is. I have a couple little props here today. This is my fancy racquetball that I've cut in half to show you. When we are determining what your prescription is, there can be what we call an astigmatism, and a lot of people always want to know, I've heard of it, but I really don't know what astigmatism is. All it is a football shape to your cornea, the front surface of the eye. Instead of it being shaped like a round rubber ball, it is shaped like a football. So take, for example, someone who is nearsighted. You can be nearsighted in one portion of the cornea and be more nearsighted or less nearsighted in the other portion of the cornea. So that's what we call astigmatism, and that phoropter that we place in front of your eyes helps us to determine what we call the spherical power of your prescription is, as well as the astigmatic portion of your prescription. And a lot of people will ask me when I'm flipping those lenses, which is better, one or two. A lot of people ask me after a while, are you trying to trick me? No, but you are seeing the lenses multiple times over to ensure the accuracy of that prescription. The prescription determination in front of that phoropter usually is the longest part of the exam for me because I really like to pin that down. We obviously want you to have the most accurate eyeglass prescription when you leave Fluder VisionCare. So that's about the phoropter. We're going to move on to the slit lamp. And the slit lamp is, and I've got a portable one here I'm going to show you in a minute, is nothing more than a large microscope that we bring in front of you. And the doctor always asks you, put your chin, bring your forehead forward. Obviously, most of you have probably had eye exams before. But it's a microscope, which is lenses and lights. Here's a portable slit lamp, okay? You can see there's oculars here that I look through, and it has lenses and lights. Your forehead would be rested right against this here, and it allows me to look at the front of the eye, the front structures. We're looking at the lashes, the lids, the cornea, the white part of your eye, which is called the conjunctiva. We're looking inside the eye at the lens, the iris, which is the colored portion of your eye. We do all of that with a slit lamp, and here's a portable version of it just for the sake of our talk here. The next thing we're going to talk about is what we call the tonometer. A tonometer allows us to check the pressure inside your eye. We call our eye an eyeball, and essentially it is a ball filled with fluid. And there is constantly fluid flowing into the eye and flowing out of the eye. There's a constant in and out flow. Patients who have glaucoma have an elevated fluid pressure in their eye and will oftentimes take eye drops to bring that pressure down. So what we do is we check that fluid pressure. And it's very similar to taking the best analogy I can come up with for everybody here is taking a tire gauge and checking the pressure in your tire. It works under a similar mechanism. Here's a portable tonometer, and again you can kind of see it has a little probe on it. And what we will do is we will put a dye in the eye. It's just an eye drop, and it also has just a mild anesthetic in it. And this tonometer, this probe, we will rest it very gently on the cornea, and as it rests on that cornea, there are what we call mires, and those mires will give us a pressure reading inside the eye. Again, very similar to a tire gauge when we check the pressure in our tires. What is a normal eye pressure? Normal eye pressures run between about 10 to 20 millimeters of mercury. Having said that, does everybody that has a pressure over 20 have glaucoma? And the answer is no. Some people just have high pressures, and that's perfectly normal for them. It's not considered glaucoma until that pressure is actually causing nerve damage to the optic nerves. And there are other tests that we do to determine that. The next thing we are going to talk about would be what we call the keratometer. The keratometer is very important if you're a contact lens wearer. You always want to ensure, whether it be at Fluder VisionCare or elsewhere where you get your eyes examined, that a keratometer is used to measure the corneal curvature. Remember, we talked earlier about the front surface of the eye, the cornea, and we talked about astigmatism. We can actually measure the actual curvature of both parts of that cornea, okay? And similar to having your shoe size, you have a corneal curvature size. Everybody does. No two people are the same. And so it's very important to actually measure that corneal curvature as well as the diameter of your cornea, because contact lenses, okay, come in different curvatures as well as different diameters. And so that's very important to ensure a proper fit, that you have those corneal measurements taken, and that's done with what we call a keratometer. And for the sake of our video here, a keratometer will be shown here on the video as well. The next item we're going to talk about, and this is a very popular one, especially with children when I bring this out, they just think this is hilarious on me, and I suppose it is. This is called a binocular indirect ophthalmoscope. I know, control your laughing. This is a very important instrument. This is a head version, if you will, of the slit lamp. I can hardly wait to see how fun this video is going to look when I actually watch it myself. This BIO, we abbreviate it, is a lens, a light, and even some mirrors in here. And it allows me to look inside your eye. And it gives me a very large view. I can see the entire inside of your retina. Because what I will do is I will put drops in that opens the pupil. We dilate the pupil. We make the pupil very large. And with the BIO on my head and a very high-powered lens that I'm going to show you here, this is a very high-powered magnifying lens. And this allows me to look inside the eye. This will be held right in front of your eye, and I will be able to check the retinas, the blood vessels. This is an extremely important part of the examination if you're diabetic, for example. Diabetic patients can often have leaking of those blood vessels. Diabetic patients can develop brittleness in their retinas. The retinal vessels are one of the most delicate vessels in our bodies, and they can leak over time. And so it's very important to have a binocular indirect examination to really assess those retinas properly. And of course, we're also looking at the optic nerves as well. Patients who have had a retinal detachment, you may have had a friend or family member that has had this, are diagnosed using this very equipment. So this is just a few of the pieces of equipment that we use during the examination at Fluder VisionCare. These are the major ones, and these are the most popular ones that people will ask me about. What is this machine and what are you doing with it? What are you determining? What are you looking at? So this concludes our second video here at Fluder VisionCare. And again, I hope you have found this very educational and at times funny. But the goal is to put you at ease when you come to Fluder VisionCare for an eye exam and to educate you about exactly what it is we're doing and how we're giving you a thorough eye examination. Thank you and stay tuned for our next video. We look forward to seeing you at Fluder VisionCare.